problem. Good afternoon. Thank you for joining us today. I am thrilled to be here today and to welcome Dr. Cecilia Rouse, Chair of the White House Economic Council of Advisors, to Cambridge and to the 5th and 7th districts of Massachusetts. We are here today to discuss our nation's path forward as we move from recovery to revitalization. And there's not a better person to have that conversation with than Cecilia. And I am so happy and grateful to be joined by my colleagues, Congresswoman Trahan and Congresswoman Ayanna Pressley, and also to be joined by State Senator Sal DiDomenico and our Mayor Sumbul Siddiqui. Thank you so much for being with us. We are also grateful to have had an incredible roundtable and tour of Nurturing Early Education Center and meet with and have a roundtable with BECMA, the Black Economic Council of Massachusetts. And everyone we met today had the same message. Care is critical economic infrastructure. It is essential to the success of our kids, to the success of our communities, and to the success of our economy. That's why we're standing here today, committed to enacting President Biden's American Families Plan. As chair of the White House Council of Economic Advisors, Cecilia truly understands how economic policy can solve the real-world challenges faced by families right now. From child and senior care to paid leave, her expertise is critical to President Biden's American Families Plan. And it all comes down to this. Without affordable, quality child care for families and paid leave, parents, and especially women, cannot succeed in the workforce. This holds back not only our economy, but creates further inequity in America. Ask any mom or daughter, including the four of us. We all have our own stories, balancing caring for kids, aging parents, sick family members, jobs, and much more. And as we heard today, those struggles are happening every single day for families here in Massachusetts 5th and around the country. That's where the American Families Plan comes in. We have to invest in our care workers, in working parents, in children, to rebuild not just back to the status quo, but a more inclusive and equitable economy. Even before the pandemic, we know families were struggling. And now, post-pandemic, over 2 million women have been forced to leave the workforce during COVID-19 crisis, including nearly 1 million mothers. Our care workforce, predominantly women and women of color, has been hit particularly hard, trying to keep their businesses afloat, their young learners safe, and struggling to care for their own families. That is why Chair Rouse, Congresswomen Trahan and Pressley, and I are fighting in Congress to get this bill passed. The American Families Plan will provide a national paid family leave, an extension of the child tax credit, universal pre-K for 3 and 4-year-olds, $400 billion for the care economy, a $15 minimum wage for care workers, and much more. These investments will generate a lifetime of benefits for 3 million children, hundreds of thousands of child care providers and workers, and 1 million parents, primarily mothers, who will be able to re-enter the labor force. This infrastructure package is how we build back better, finally acknowledging and honoring what has always been true. Care is economic infrastructure. Thank you, and now I am proud to introduce Chair Cecilia Rouse.
Thank you, Assistant Speaker Clark. I'm absolutely thrilled to be here today and to be sharing the podium with Representative Trahan and Pressley. As Assistant Speaker Clark said, before this we had a wonderful opportunity to meet with early educators who run Nursery Early Education and to hear from the members of BECMA who all shared very compelling stories about the barriers that they face as business people and as those who are trying to balance care and work for themselves and their workers. Across the administration, from the president to cabinet secretaries and others, we are getting the word out on how building back better means making robust investments to revitalize our care infrastructure. So President Biden is speaking today, and he is speaking on the American Families Plan and how it reflects those priorities. We need to get this right. My team at the Council of Economic Advisors is conducting analyses on the impact of the American Families Plans on American workers. Research shows that one reason the U.S. labor force participation rate among prime-age adults has fallen behind our peer countries and stayed below its 1999 level for the past 22 years is our lack of robust childcare and paid leave policies. The pandemic only exacerbated this problem, pushing millions of people, especially women, out of the labor force and eroding more than 30 years of progress in women's labor force participation. Yes, the public sector must invest in physical infrastructure to strengthen the foundations of our communities. But in exactly the same vein, the public sector must invest in people, in working families who are the engine of our economy. In my role as a member of President Biden's Families Cabinet, I look forward to working together with members of Congress who are here today and many others to get our shared priorities across the finish line. So thank you.
Thank you so much. Congresswoman Trahan, here.
Well, I'll certainly be brief because I echo the remarks of Assistant Speaker Clark and Chair Rouse. As the daughter of a child care provider, a domestic worker, and as the mother of two elementary school daughters, I know firsthand how much of a struggle it is for moms, for working moms, to find the care that they need. And this is an economic imperative, especially at this moment. When we're trying to accelerate our economic recovery, we're trying to build back better in a way that is more inclusive for all people. I represent the communities of Lowell and Lawrence, and what is so necessary right now is that we honor and we ennoble these family-sustaining jobs in child care. So I'm so happy to support the Families Plan. It's long overdue, but these are the investments that are really going to transform our economy, transform the lives of working families across our country, certainly in the district I'm proud to represent, but it's also going to make our country more competitive, because when you invest in people, when you invest in closing the achievement gap and invest in a more innovative future, our country wins. And I think that's what we all should be standing for as we exit the pandemic. Thank you.
Thank you. Congresswoman Pressley.
Becomes increasingly more difficult to offer a unique insight here, so I vigorously co-sign the comments that have been said by Assistant Speaker Clark, Congresswoman Trahan, and Chair Rouse. I would just, building on that, say, in representing the Massachusetts 7th Congressional District, one of the most unequal districts in the country. We're in a 3-mile radius. Life expectancy and household income drops by $50,000. That this is a racial justice issue. This is how we close the racial wealth gap. This is how we close the achievement gap by ensuring that everyone has access, every family, and I don't mean to genderize the issue. We're all women standing up here, but that's because disproportionately, just as we've seen in recessions, that the impacts, the economic hardship of this pandemic, that burden has been disproportionately bore by women. And we know that they will be the slowest to recover from this pandemic. But this is one of the most unequal districts in the country, certainly the most unequal in our delegation. And these investments in access to affordable quality childcare, but not just about stabilizing families and stabilizing our workforce, because this is as much about the GDP as it is about our families, right? But I really appreciate the commitment and the investment to our child care workers, who are also overwhelmingly women and women of color. These are educators. These are innovators. I'm sure that, parents, when their child has an earache or something, they'll probably be more inclined to call that early education and care provider before they would even call their pediatrician to get advice and to find out, how their child is doing and how they can best support them. So physical infrastructure matters, human infrastructure matters, and we need to make those robust investments, not only to ensure a just, equitable, and robust recovery, but also to chart a better path forward so that we do not recover to an insufficient pre-COVID normal, which was already unjust to begin with.
Excellent. We'll open up to questions.
I'm just wondering for any of you, what is a realistic, for people who are just, really waiting for this to happen, what's a realistic timeline for the American Families Plan to pass and be up and running?
Our concern right now is making sure that we get this done. And we know that we were elected in 2020 because people want results. So, we have been hard at work. We are so appreciative of the administration's partnership in setting forth this plan. But, we are looking in a matter of months because we know that this is so important. But what's most important is that the policies that we have heard about today, the factors that make this work for parents and providers, that we are meeting those and refining those. So we're going to get this done as quickly as we can, but do it right, because this is a tremendous opportunity and we simply can't afford not to meet these needs. I don't know if anyone else wants to add?
On that point, I was going to ask if you've all talked about how vital this is, but suppose you've seen what's been happening with the infrastructure bill. Is it conceivable to you that this moment could slip away, that this might not happen? Tell me about that. What would that be like for you?
Not if we have anything to say about it, and we have a lot to say about it. We simply can't approach this as an either or which families are we going to leave behind? How are we going to meet this moment in our country's history of racial, economic, and climate justice if we're saying, well, we're going to go part way? This pandemic has shown, as my colleagues have said, it's revealed these inequities that have already been there. So let's address them. And, there's lots to talk about. Infrastructure and human capital and human infrastructure, but it really comes down to this. We want to create an economy that works for everyone. And the way we do that is we create good jobs and ways for the workforce to get there. And roads and bridges are just as important as childcare and elder care. But we can't leave one of these critical components behind.
One thing that I will add, because we talk a lot about our priorities and not letting one sort of trade off against the other. I mean, these are like widely accepted and supported priorities across the country, certainly across the district I work in. When I talk to folks about their economic recovery, when I talk about what's holding them back from going to work, it's because their child provider isn't there anymore. Our child care providers have had to downsize because, their providers are, at home with children. I mean, this is an economic imperative, and I think, one of the reasons why we're adamant about making sure that this doesn't get lost in this moment is because it's so long overdue, and that if we are going to build an economy that takes into account, women's participation, that we have to take advantage of this moment with a child care policy like you're seeing put forth in the American Families Plan, like finally paid family and medical leave, like the expansion of the child tax credit, all things that are directly supporting families and that they're feeling and that they want to make sure that we prioritize as we go into these discussions.
Absolutely, and I would just add to that and say that, certainly we're vigorously championing this, but we're doing that in being responsive to the urgent needs of the people and the families whom we represent. I'll never forget early in the pandemic receiving a call at 11 o'clock at night on my cell phone from an essential worker who was a single mom, like the household I grew up in, with an only child, like the house I grew up in, and she didn't feel well. But she had to go to work, and there was no one to care. She had no family to support caring for her daughter. And so she asked me, Congresswoman Pressley, can you assure me that if I go to work sick tomorrow, if I choose to stay home to be with my child and because I don't feel well, that there will still be a job waiting for me. And the fact that I could not give her that assurance is unconscionable. So all of these things are really interconnected. The child tax credit, which is, economists are characterizing it as the biggest anti-poverty bill in modern times. That'll cut child poverty in half, and that money is starting to hit the pockets and the accounts of families. Paid family medical leave. People working at a living wage, and making these investments both in our child care providers. We learned at the Nurtury Center, Assistant Speaker Clark was talking about how many of our child care, our early education providers are being paid less than some of our summer lifeguards. That is just unacceptable, that they would be paid at such anemic levels. During the BECMA roundtable, we kept centering the word dignity and respect. These are people that we are charging with pouring into, shaping, and molding the stewardship of our children, which will quite literally determine their life trajectory. And it's just unacceptable. So we've just, passed the American Rescue Plan. We need the American Families Plan to ensure that we're rescuing everyone, that we don't leave anybody behind in this recovery.
But given the resistance of the Republicans, is the realistic way this happens is infrastructure gets pulled out and this happens through reconciliation? Is that the
So President Biden is committed to making the robust investments through the bipartisan physical infrastructure compromise that he brokered. And he's also fully committed, which is why we are all out here. There are cabinet secretaries across the country. President Biden is speaking himself. He's fully committed to seeing the priorities in the American Families Plan and those priorities that were in the American Jobs Plan that were not in the compromise passing as well. As he has said, he recognizes the import of this moment, and it existed before the pandemic. This is why it's building back better. This is not just building back to February of 2020. This is building back better. And he's committed to making these investments. What he has said is inaction is not an option. So he is putting all of his, all of his assets and his time and energy into doing to ensuring that these priorities pass. This is why we're here. We understand how very important it is. If we're going to see the kind of productivity enhancing investments that this country needs that are long overdue, and that we know that we need to do in order to increase economic growth and to ensure that that increased growth is widely shared.
I just want to add one thing to that we talk a lot about bipartisan infrastructure plans and what that means. The American Families Plan is so bipartisan in every single part of our country except the Beltway. And so we need the Beltway and Congress to catch up with the American people and seize this moment and meet their needs.
Yes, that's a very important point.
Let me ask you, why is it such a hard sell if it's so popular across the country? And I'm not trying to ask that in a confrontational way. I mean, what does it take to sell that to the people in office who are not quite on board with that yet?
That is an excellent question.
Do you mind popping in front of the mic?
No. That is an excellent question for my colleagues across the aisle. Let's just go back to the month of March, where we are facing, coming out of just economic devastation, shutting down our economy, record job loss, unemployment, schools closed, the need to get vaccines in arms. And we were not able to garner a single Republican vote for all of that work that we did. And so that is the question of this time. What is it going to take to truly have bipartisan support to get our economy going again. What could be more fundamental to our role as representatives in Congress than making sure that we meet this moment and rebuild our economy in the most inclusive way that is not only good for families, but will position us as global competitors and keep us as a preeminent economy in the world.
For the chair. I just wanted to ask, we're hearing a lot about the difficulty in hiring and keeping childcare workers these days, and I'm just wondering if any of that has to do with, if there's any unintended consequences with unemployment extensions and benefits and such. Is there any concern about that from your perspective?
So here's what I think is important to understand. The pandemic caused a recession that we have not seen before. This recession, many people have asked me from the beginning, how does this recession compare to the Great Recession? Well, the Great Recession was caused by a problem in the economy. This is a pandemic-induced recession, the likes of which the world has not seen. We basically put the global economy in a pandemic-induced coma, and you don't just come out of a coma and just start functioning again. So maybe on the chalkboard, so I teach economics, on the chalkboard, economies reach equilibrium, in an instantaneously. In the real world, it takes time. What we saw is that companies reduced their inventories last year when people were not buying. So they reduced inventories, often at a loss. And now they need to restock and refill their inventories, and they can't happen overnight. They can't wave a magic wand. Suddenly, the bins are full. One of my staffers is looking for a wedding dress. They've got a supply chain problem too. And they said they just didn't magically wave wedding dresses because the designers weren't sure whether big weddings were coming back. They weren't designing, and then all along that supply chain. So we even heard about it at the Child Care Center. They're now having supply chain issues, not only in their workers, but in getting food. So we are in the process of restarting this economy. And it is profound, and I definitely understand that. But we also believe that this economy is resilient. It's not just the United States, it's a global economy, and it will knit itself back together. So fundamentally, I believe that this is part and parcel of coming out of a profound recession that was induced by a pandemic. So yes, we see evidence that the demand for workers is greater than the supply of workers. Workers are hesitant to come back because we still have the pandemic among us. We know that many workers are vaccinated. Here in Massachusetts, A+. There's an A+, but we also know in parts of the country the vaccine hesitancy is real. Actually, even here in Massachusetts, we were hearing some of that today as well. We know that childcare is still an ongoing problem. Schools are open, but not necessarily full time, so that workers know that they can send their children to work and they can take a job, and that the school won't shut down, or that there are not truncated hours. And yes, we've provided workers with the resources to navigate through this recession. We think it's important. We followed a policy of separating workers and employers. Workers now need to find suitable employment, and that takes time. It takes time to find the right employer and the right employment opportunity. So we will heal. I have no doubt about that, but it will take time. This was a rather profound recession.
And again, I would just say that when we have conversations in community, the number one thing that we hear from employees is that they don't have access to, in particular, school-age childcare. We've heard that over and over again, but I don't want to just make the care economy only about childcare. I vice chair the task force on aging and families. The sandwich generation is booming. These are families who are responsible for an aging parent and also a young child. There's tremendous responsibility, and although there's no place else in the world you would rather be, there is a burden, and that burden needs to be alleviated, and we need to make these investments. So this is about elder care. This is about child care. It's also about home and community-based services, which is a disability justice issue. So care economy is infrastructure, and we have to invest in it like it is.
Last question?
I just have an off-topic question for Congresswoman Pressley.
I have an off-topic one too.
Can we
wrap today? Thank you, everybody.
Thanks, everyone.
Thank you.